Good afternoon. I want to thank everybody who joins us. My name is Lopatina, and Ukraine Media Center continues its operation today. And our following broadcast is dedicated to the discussion about the access of the women to the medical services. We are going to discuss the challenges existing for the women during the fourth year of the full-scale invasion. On the 8th of March, we are going to celebrate the International Women's Day, the day for fight for women's rights. And in the eve of this day, it would be quite necessary to discuss the problems the women are facing today. And Ukraine, in cooperation with charitable fund fighting tuberculosis and Women for Human Rights, will discuss the access of the women to the quality medical services. So let me introduce our guests. Joining us today are Yaroslava Lopatina, Country Program Director, AIDS Healthcare Foundation in Ukraine. Also joining us is Olena Stryzhak, Chair of the Board of Positive Women NGO. And also joining us is Yuliia Kalancha, Executive Director for TB European Coalition. Thank you for joining us today, dear friends. And I would like to start this conversation with the situation in Ukraine, the situation with the access to the medical services for women. So, Yaroslava, the floor is yours. And right away, I would like to ask you if you're observing the gender aspects in that fight that we're fighting today in Ukraine, our fight with HIV. Well, good afternoon, dear friends. First of all, I would like to say that more than 100 years have passed since this day, the 8th of March, was established as International Women's Day. And I would like to say that the problems pursuant to which this day has emerged, they still exist. A lot was solved, but there is still inequality in the access of women to medical services. There is inequality here too. And when it comes to the actual nature of it on a declarative level, yeah, we declare the same level of access for both genders. The regulatory documents are not gender-oriented, but probably it's bad that they're not gender-oriented in terms of access of women to the medical services. Unfortunately, in Ukraine, there are no existing studies, but we've studied the international experience. Is there any difference between provision of services to the women comparing to the provision of services to the men? Yes, it does. For example, when it comes to curation of pain, if women come with complaints of ache, they are being assigned sedatives. If a man addresses a doctor with the same problem, they're being assigned with the painkillers. So sometimes the stereotype exists that women may exaggerate the nature of the symptoms. So again, if we take a look at our healthcare system, who works there? In majority, those are the women. Among the doctors, the majority is also women, but when it comes to medium and junior medical personnel, 90%, 95% are the women. We all know that the salaries in the healthcare sector is really modest, and the gender stereotypes work there too, that the women agree to smaller salaries. They agree to work for smaller salaries, and it's seen as a standard that if it's a woman, they can make less. It's normal for women to make less money. Well, I mean, it's sarcastic. I'm being sarcastic. And for men, it's not okay if they agree to small salary. So here, there is definitely gender inequality when it comes to payment of work. Even in the fundamental approach to it. And when it comes to the vulnerability of the women, we're discussing HIV, tuberculosis, they're socially significant diseases. So again, when it comes to the women, are we more vulnerable to HIV? Yes, it is so. It's related to female biology. The chances of contracting HIV are way bigger for women than for the men. It's a clearly biological mechanism, but why are those diseases classified as socially significant? Because in case of tuberculosis or in case of HIV, the social factors matter, and they impact women more than men. For example, the use of condoms. Family. A woman may know that their husband cheats on them, but they may suspect, but it's not accepted in a culture for women to force their husband to use a condom in that case. And the status of HIV infection, why don't women disclose that status in their families? Because there's a lot of data that women may be exposed to violence by their exercised by their partners. And during the times of full-scale invasion, there's a lot of IDPs among the women, and women are directly affected thus. The women are not all by themselves. They have obligations. It's accepted in the society that it's the women who take care of the elderly parents, of the children. The men are usually less involved in those processes, and in such conditions, women frequently forget about their needs and they don't seek medical aid, or they seek it when their condition becomes real difficult, when their disease proceeds to the difficult stages. Well, in this context, what are the challenges for civil sector, for international organizations? How are you seeing it? Well, first of all, we have to overcome this gender inequality. It's important to do it from the very, very beginning, starting from the very education, what we call positive masculinity. And we have to educate, to raise our girls in standards of equality. For example, we have the Girls Act program. We work with the girls, with teenagers. We have boys attending our classes too. They can attend as well. And we're discussing some very specific things. For example, how to protect yourself against the sexually transmitted diseases. This is what we discuss with the girls. We talk about leadership when girls become the driver of changes in their environment. We talk about future professions, because the foundation of women's well-being is their economic independence. Thank you, Ms. Olena. I know that civil organization Positive Women, they they have a study about the influence of war on the condition of and the situation for the women with HIV. Can you please share the results? Well, first of all, good afternoon. I would like to thank Ms. Yaroslava for organizing this event, for inviting us, because as it was already said, we work on behalf of the women and we work for women. But quite frequently we forget about the needs of the women and we only recall them during some dates, like holidays. But even now, despite the full-scale invasion, despite all of those problems and challenges we're having, I'm still real happy for having this interesting audience that we've all gathered here, and that we don't stop. First of all, we don't have to stop, and this is what we demonstrate. We're not stopping. We take all of our efforts to draw the attention of the public to the problems of the women, and this is why I would like to demonstrate some figures today, because we've started our work long ago, but when it comes to the needs, we were asking we were asked, like, you say there's a lot of needs, there's a lot of demand for something, but how can you prove it? Show us the figures. For example, when we talk about the violation of women's rights in the medical institutions, we are being asked, okay, where are the complaints? And we're saying the women are afraid. We had cases when the women were submitting when they were reporting, they were submitting complaints, but then the management of a medical institution, they started exercising pressure on her. The letter was like, we're about to gather our collegium, our collective, and we will report you, like you were saying something bad against someone else. And when women face such an attitude, they don't have support by their side, they're not gonna report. And okay, let's not forget that women with HIV-positive status, that's a confidential information. And for the time being, this disease has high level of stigmatization and discrimination. And when women find out about it, they hope that this diagnosis dies with them. And we work to make sure that this stigma disappears, because this is why we have such indicators of women not reporting. Unfortunately, we have cases when children contract HIV from their mothers because women don't get registered. They don't want to get tested for HIV, and it may result in children contraction HIV from their mothers. So back in 2014, for the first time, we've decided our community of the women living with HIV. Our organization is a self-organization. We are the women living with HIV who banded together, started like united as an initiative group, and then we've decided that we want to register a non-profit organization. We have representative offices in 22 regions of Ukraine, basically in all of the regions apart from the temporarily occupied, but sometimes even in the temporarily occupied regions, when women report, if it doesn't result in any threat for them, we try to provide as much support as possible, because we understand that women always need help. We cannot leave them, but we still remember, I recall those women who are staying in the temporarily occupied territories. What about them? What's going on with them? We cannot communicate normally. So in some cases, we just completely lost lost all of the ties with them. So in 2015, we've approached this matter in a more fundamental manner. We wanted to have the figures to operate. And during all that time, when we've got our first data about the violation of women's rights, where is the biggest barriers in their services, and we've realized that in the medical institutions, unfortunately, still we understand that it's a chronic disease, HIV infection. Whether you want it or not, first you report to medical institution because it's a disease you need to get cured. And as we've realized that we've started working, as Yaroslava has mentioned, we started working with the medical personnel to overcome the stigmatization and the fear that results in lack of quality services, refusal for treatment, contraction of HIV by the children from their mothers, then contraction of HIV by partners. So again, our task is to remove the barriers in the area of medical services, and it may be like too ambitious, but we would like to eradicate this HIV-related stigma. And last year, we've come up with analytics about the women's access to the medical services. So we've prepared the biggest figures, the most demonstrative figures. In case of 36% of the women starting with the full-scale invasion, their health condition has deteriorated. Almost 70% of the women, they say that caring about themselves is now juxtaposed with the caring about their basic needs. The emotional condition of the women is quite different. We were seeing quite different condition when women were coming. They were ready to talk. They were ready to open up. Now it's way more problematic. And as you see, the level of testing for HIV has decreased 15% in the year 2023, and I've already told you about the consequences. They are definitely not positive. On top of that, we have difficulties with funding that was intended for testing, for expansion of testing. Those were colossal amounts of money. It has already influenced the level of testing. Without testing, without identification, we won't be able to treat the women, and that epidemics that we have, the epidemics of HIV and tuberculosis, is only gonna spread, and it will be complemented by the war. So the situation is really critical. But again, we never stopped, and we don't plan to do so. Again, there are more figures. You know that the medical institutions were destroyed, and now they cannot accept not only women, but any patients whatsoever. So just imagine when women are facing this choice, whether to buy food to feed their children or to spend that money to get to the medical institution that became hundreds of kilometers more distant. Obviously, no. Obviously, she's not going to come for antiretrovirus therapy. They're not coming for checkup of their health condition, but rather they're spending that money on feeding their children. So 80% of HIV-positive services were unable to receive gynecological medical services because the medical institutions were shut down. Also, more than a third of the women were facing discrimination as they were given birth. That's a standalone topic. You see the biggest figures. To save our time, I'm not going to cover them, but I would rather answer the questions that would be of interest to you. But half of the women who live with HIV, they report to medical institutions after 25 weeks of pregnancy. According to the protocols, that period is 12 weeks, so they're supposed to get registered by the medical institutions before the 3-month period of pregnancy. So sometimes those are the periods when women don't want to see anybody, and on top of that, when they had a negative experience of interaction with medical institutions, they will take all possible efforts to avoid such interaction in future. So again, when it comes to stigma discrimination in the medical institutions for the women, as you understand, quite an important topic. Yeah, every single one of us knows that we use the services of gynecological services, gynecological nurses. So it's the most discriminative service in our case. They demonstrate the highest level of discrimination as women obtain medical services there. So we banded together with the international organizations, with the partners, with the Ministry of Healthcare to change it, to change the regulations that govern this attitude, to draw everyone's attention to the fact that the doctors are supposed to treat with tolerance the patients who live with HIV, but by large account to every single woman or girl, they should treat them as humans, but not like back from those times of the Soviet Union when you come to a medical institution and right away you're feeling this burden like the doctors are the gods your life depends on, and the level of service depends on. That's definitely wrong. We try to take our best efforts to establish respect in these horizontal ties, to establish human-centric approach, to put it in the first place. And again, it was not my saying, but our team. I wanted to share it with you. We cannot change the consequences of the war, but we can stop the discrimination because of which the women, the HIV positive women don't get necessary medical services in Ukraine. Thank you. Ms. Yulia, I know that you had a research, your foundation had a research on gender positive services. Can you share the results with us? Uh, well, good afternoon. Thank you for invitation. Thank you for this initiative to discuss this important topic. It's my pleasure to greet you on behalf of the European Advocacy Network that unites more than 500 organizations in 57 countries of the world. Based in Ukraine, we pay a lot of attention to the local challenges in the area of healthcare. And today I would like to touch upon an important topic, how the gender factors influence the overcoming of tuberculosis in Ukraine. At first sight, tuberculosis is an infectious disease that has nothing in common with the gender, but if we dig deeper, it becomes obvious when and how people are being diagnosed, what are the chances to finalize the treatment. It all depends on a lot of social factors, including gender. Gender inequality in healthcare is being demonstrated in a number of levels that has been corroborated by the partner research in Ukraine. For example, access to diagnostics. The study demonstrates that women seek help later because more frequently they're focused on caring about their children, their families, as Yaroslava has mentioned, and the conditions for examination may be not convenient. For example, absence of privacy in some cases of testing, financial vulnerability, the women, those who are not officially employed or those who are involved in the household care, they don't have opportunities to pay for transport services. They cannot find anybody who would take care of their children or elderly parents in their place. The situation is even more difficult in rural areas. It's difficult to get to the medical institutions, and the family's resources are spent for different purposes, as Olena was saying. Tuberculosis doesn't only have a medical but also a social impact. There were cases when the husbands were leaving their wives in when they were diagnosed with tuberculosis. However, it doesn't happen the other way around. The women may try to avoid treatment because of their fear to lose children. The women have higher level of self-stigmatization, and there is a dependency between self-stigma and the age. The elder are the women, the higher is the level of self-stigmatization, violence, and dependency. The studies in Central Asia and Europe demonstrate that the women who were exposed to domestic gender-based violence have higher level of interruption of treatment because they face the fear of aggression by the partner or financial dependency. Medical conditions, the absence of detached rooms creates additional discomfort, just like absence of, say, bathroom. Such minor things may reduce their desire to finalize the treatment. Social support doesn't always take into account the gender needs. For example, men and women may be provided the same sanitary kits. Meanwhile, the women may need other things, other products such as specialized washing agents for, or like hygienic pads. So it's important to pay attention to those who provide those medical services. can, for example, such people preserve gender equality if they never experienced it, if they don't know what are the gender aspects of health? They were never trained in a relevant way. This is exactly why we've decided to study this matter in a more profound way, and with the support of the Center for Public Health of the Ministry of Health of Ukraine, we've decided to make this study about the inclusion in the workplace among the medical employees who take part in treatment of tuberculosis. It allowed us to look at the problem at a wider angle, not only from the patient's perspective, but taking into account the working conditions of the medical employees themselves. So the physiatrists, the representatives of local authorities, representatives of civil society, and educational institutions were surveyed, and we found out that the gender policy in the workplace influences the quality of services obtained by the patients. And if there are no equal opportunities, culture of non-discrimination and respect in the medical institutions themselves, it reflects on the way the medical services are provided. According to official data, the Center for Public Health of the Ministry of Health of Ukraine, as of August 2024, in the network of anti-tuberculosis institutions of Ukraine, almost 6,000 medical employees were employed, including 70% of the women. The share of the men is a little bit bigger when it comes to administrative personnel, and among the medium and lower rank medical personnel, the share of the women is even bigger. However, what's interesting is different. If we take a look at the offices, hires offices, 2/3 of the chief doctors are the men. So the women are in absolute minority among the medical employees, and they have low access to career growth. Well, our study has not identified any formal gender discrimination. However, in Ukraine, what we observe is the gap in income for men and women. And according to Gender Commissioner of the Parliament of Ukraine, the women were making more than 6% less than the men in the labor market, which is explained by the segregation and lower representation of the women in management position. Another aspect was safety of the workplace. The tabletop study conducted by Deloitte in the years 2021-2022, the level of gender awareness about the medical employees in Ukraine demonstrated that the medical workers identified the risks related to the absence of security in the hospitals, the cases of aggression by the patients, and absence of police reaction to such incidents. Also, it was identified that in the countries of EU, 1 in 3 women were exposed to certain type of violence, and a significant share of such cases are happening in the workplaces. And regardless of existence of recommendations for the gender-sensitive patients, our study demonstrated that for the majority of medical workers, this is a new notion. They don't have necessary level of awareness for implementation of such approaches in their work. One of the key conclusions of our study is the necessity of integration of training courses on gender equality and education programs for medical workers, not fragmented trainings, but a systemic work that will formulate the clear understanding of gender-sensitive approaches in medical services, because without such understanding, it's impossible to implement quality changes in the healthcare sector. And we're convinced that equal access to the services is not only a matter of medical system, it's a more of a broad social challenge. And if we want to overcome tuberculosis in an efficient manner, we need to establish conditions in which everybody, regardless of their gender, have access to the quality medical services. And to do this, the medical workers should work in the system that ensures security and equality. And we urge all of the government agencies to integrate the education aspects in training of the medical personnel, and our international partners support through training and financial support. The examples I've given in the beginning demonstrate that it's not only about the equality but efficiency of the medical services and saving lives. And you can get familiarized with the conclusions of our study upon direct address or at the website of our organization. Well, thank you for this information. Ms. Yuliia started disclosing the recommendations, the specific activities that should be implemented to bring those changes. Let's discuss it in more detail. I understand that you all work in your areas for quite a long time, and you have understanding of what needs to be changed at the level of the state, at the level of the society. It's important really to hear your recommendations based on your experience. Well, is it a question to me? Well, to everybody, to all of you. Well, I would really start with the initiative that we have today. I would share it because for us is the most important one, the one that we've initiated last year. And I think that, as you may know, all of the initiatives related to the amendment of legislation or documents that regulate that activity, they are really difficult to move. Sometimes year may pass for any change to take place, for a document to be drawn up, for it to be approved, to launch it, and to use it in future. So again, based on our analytics, we've called it the nursery violence against the women living with HIV. I've already mentioned it, the gynecological nursery. That's a critical sphere for not only for the women who live with HIV, but for other vulnerable categories. Under that, we understand transgender women, sex workers, or women who are addicted to substances. They are being discriminated on a regular basis because they can also fall under category of women living with HIV. They have those women. They may have additional vulnerabilities that is being discriminated as well. So gynecological services for the time being after the medical reform, they don't have this structure they had before. So when it comes to obstetrician health, starting from the year 2018, even the format of aid has changed, the mechanisms have changed, the algorithms, and there is no document which would regulate the activities of the organizations on the national and local level. So again, relying upon the data of our analysis, we've brought this topic to the attention of the Ministry of Health, and then with the partners, with international organizations, well, we were supported in this initiative, but unfortunately, it's a lengthy process, and for us to prepare those documents, we need to gather the interested parties, as we call them. They may be interested, but they don't have resources. They may have interest, but they don't have time or desire to get involved. But again, relying upon what I've already mentioned, in cooperation with the Ministry of Health and interested parties, we're preparing the procedure. It's a whole different mechanism that would regulate the implementation of medical services. So we're preparing this procedure that would include all those data that I've mentioned to change the level of stigmatization and discrimination that we have in the obstetrician services sector. One of the procedure will be the provision of ethics of interaction between the medical personnel and women who are obtaining those medical services. We are going to do it for all of the women and girls of Ukraine. So roughly having this expertise that we've been developing for years, we've become the voice of all of the women, not only HIV positive, but all of the women who reside in Ukraine. A really important thing that never existed in Ukraine. We really wanted to happen. We've added the category of transgender women because they exist. That's a really very closed category of women. You know, they have a very high level of stigmatization and discrimination. Transgender women, they fight in the front lines, and even there, their level of discrimination is pretty high. So we want this topic to be at least mentioned. We want the medics to be explained that such women exist. The number may be growing, but there is no way we can segregate them as a separate category of women. We're supposed to help the women is the basic mission in provision of medical services. Thank you. Yaroslava, what about your recommendations? I would like to say that a lot depends on the culture. If there is corporate culture, if there is, then there is social culture, and our social culture is such that doesn't provide equality between men and women. My colleagues Olena, Yuliia were giving you the examples when the women they work. Almost all of the women work in tuberculosis services, but the heads of the services are still the men. Well, there is an aware audience, activists here, and if we ask average people, they're gonna say it's normal. They're gonna say there's nothing special about it. And that's exactly why in the beginning I was saying that we have to change the culture. If 10% of the people realize that it's a problem, only 10%, I think that things are going to change. And the regulations, they are about to become like obvious for changes. The changes are going to become obvious, the necessity for those changes, and then we will not have to spend that much resources to prove it to the authorities, to the government officials, to prove that those changes are necessary. It sounds just absolutely outrageous to me, like what Olena was saying, that treating a pregnant woman with respect, in order to treat a pregnant woman with respect, some paperwork is required, but I understand that without the paperwork, it's not going to work otherwise. So if medical workers treat a women with disrespect, with stigma, if they discriminate the women, there should be a mechanism in place to bring them to accountability, but that's not normal. I mean, it sounds like absolutely surprising, at least, because any woman, any man, like, they address the medical personnel for aid. They're afraid for their life, for their health, and they're getting a portion of hate, of negative. Well, that's horrific. And that's exactly why we started working with the girls. They are the future, so that they have this so that this equality is a standard for them, so that they don't have that stigma, so that they don't see themselves as somebody who cannot become a manager, right? Like they may be told, like, where are you going? That's not for you. Just remain a nurse, make your 6,000 hryvnia of salary, and that's it. You don't need anything else. But a person should not be, a girl should not be in agreement with this inside. And this is why we have this Girls Act program, where we train the girls some practical skills, not only practical skills like how to defend themselves, how to protect their sexual and reproductive health, but they also study the confidence, the leadership that the women, as a human being, they deserve respect, not because there is some document, but I'm just saying that it's a deeply rooted problem when we have to regulate respects with some documents. Well, thank you. If there are any reflections, comments, questions on the floor, please let me know. Please. Good afternoon. My name is Anastasia. I am not an HIV-positive woman. My mother is, but I would like to discuss the topic of discrimination. It starts back in school. I don't know. When I was studying, there was such a discipline as the foundations of health, and I don't know whether it still exists, and I don't know whether that author still makes textbooks for the students. We had a textbook authored by Boychuk, and there was a topic of violence, and it described how to protect yourself against the violence, and it was said that the girl provoked the violators with or perpetrators with bright makeup or short skirts. So it's the women who provoke. Yeah, that's an existing problem. There were many comments about the textbook, I remember. Well, I fully support you, and I really want to thank you. I think that among your peers, you're probably describing it under the right angle, and it's correct because only through ourselves we can communicate those changes. We were practicing it before, and we continue addressing the goals and sharing our experience. For example, when we're saying, like, previously, they were saying that the girls didn't know that they have a right to refuse the sexual relations. No one told us before, and now we have to bring those changes by ourselves. Like, if now the things are happening at the level of the ministers. If we want to change something, we need to write letters for years to demand the textbook to be revoked from the curriculum. It's a lengthy process, but now that we're talking about it, that's already a small victory, because using our example, we demonstrate the changes that are supposed to happen, that it's absolutely unacceptable that children use those textbooks for study, and they have this position. This program that was mentioned, it covers not only girls with HIV, but others who are just curious, those who want to come and to study. So those programs, they are aimed at sexual and reproductive health. When we discuss the fundamentals of relations between boys and girls, well, the interaction in general, the relations in general, we were discussing it with Yaroslava, like there is such a notion as social and reproductive health. They cannot be segregated, because previously the women were accepted as a function, as a reproductive function. So it was shameful to talk about sexual health. So who were the women? They were the reproductive functions, and we were discussing reproductive health. That's not right. We're communicating it to the girls that they have a right to refuse, to say no. there is such a thing as consent. So there's a lot of things we've never even heard before about, and it's good that we've finally found out about those changes, and we are the changes ourselves. And thank you for your question. And I wanted to correct myself when I was talking about the transgender women. I said we support them, but when I mentioned the policies about the transgender people, there is certain specifics when there is this transition. It already comes to physiological things. So when it's still a woman, but they become transgender men, it's a sensitive topics, but we need to add this information about transgender people to that policy as an explanation so that the medics find out more about it, because that's our reality. It's not getting away from us. We need to know how to work and how to help each other. Well, to finalize our meeting, I would like to understand the dynamics. Where are we moving? You've been working in your areas for years. You can evaluate the dynamics. So to what extent are you feeling this progress? Can we safely state that we're moving in the right direction, including in terms of development of the medical services? Well, in order not to take everyone's time, I'm humbled by the fact that when we talk about the changes, about the accessibility, for me, the biggest achievement of ours is that the women who live with HIV, they become parts of the coordination mechanisms. We work in the task forces on elimination of contraction of HIV by the children from their mothers. They work on that narrow niche topic. But we're talking about all of the women, absolutely. Using our example, we bring the changes to the medical sphere through the women who live with HIV. We proclaim the needs of all of the women, and we see those changes on part of the medical personnel. Let them be tiny, but they are still there. So let's not stop moving. We are seeing certain progress in tuberculosis. It's reflected in regulations, and what I've mentioned in my speech about the tuberculosis advice, they emphasize the gender-sensitive consultations. But again, the question here is about awareness and understanding. Do the doctors really know what's written in those standards that were developed for them? Because as our study has demonstrated, many doctors have no knowledge about the gender-sensitive consultations they are supposed to provide in compliance with the standards. And I really appreciate this comment, because this statement corroborates what I was saying about the recommendations. I was saying about the recommendations for medical personnel and education of medical personnel, but we see that we have to go to all of the spheres of education programs for the students of the schools, universities, to explain, to raise awareness on HIV, tuberculosis. So I'm urging ourselves as activists to pay more attention to the awareness programs when it comes to HIV and tuberculosis and gender aspects. Thanks a lot. Well, really, the progress is there. As a doctor, I remember the period when HIV-positive women were coming pregnant to gynecologists, and when they were forced to abort the fetus, when it was already known that HIV-positive women may bear HIV-negative children. The situation has shifted to the better now, but still we're working in this sphere. HIV, tuberculosis, they are like a locomotive for the whole healthcare system. And it's really so. And I'm seeing those changes to the better, but when I'm walking in the street and I see young men talking to young girls all the disrespect they're demonstrating. And the girls are giggling at that time. And this is when I understand that the problem is really, really deep-rooted, and we have a lot of work to do. Thank you very much for this conversation. Thank you for the great job you're doing. I want to thank all of the guests. We realize that the fight for the right of the women is on. The challenges are changing, they're transforming, but in the conditions of the full-scale invasion, they become even more present. So I want to thank everybody who works in this area, those who change our country to the better. Let's continue working together for our victory. Thank you. I want to thank our armed forces, and glory to Ukraine, glory to the heroes.